What is chlamydia and how do I get it?
Chlamydia is a sexually transmitted disease, meaning it's spread through sex, including vaginal, anal, and oral sex. It is caused by a bacteria that can easily move from one person to another through direct sexual contact with an infected person. Note that chlamydia can still be transmitted even if the man does not ejaculate. It is also possible to get a chlamydia infection in other parts of the body. For an example, a person can get an eye infection if the eyes are rubbed after touching bodily fluids infected with the chlamydia bacteria.
Can both men and women get chlamydia?
Yes, both men and women can get chlamydia. However, women can get it more easily than a man can because the female has more places internally for germs to hang out and cause infection.
How do you know you have chlamydia? Is it easy to spot?
It actually isn't easy to spot. Most of the time, there aren't even any symptoms. In fact, 4 out of 5 women with chlamydia don't even know they have it. So people are living with it and spreading it without knowing. That is why chlamydia is known as the silent infection.
Chlamydia is not that common, right?
Actually, chlamydia is one of the most common STDs. According to the CDC, an estimated 2.86 million chlamydia infections occur annually. Anyone who is sexually active is at risk for chlamydia.
What are the signs and symptoms of chlamydia?
Even though chlamydia does not often show symptoms, if there are symptoms, they would appear about 7 to 14 days after being exposed to the chlamydia bacteria. When women have symptoms, they may notice unusual discharge from the vagina, bleeding between menstrual periods, pain or burning during urination, abdominal pain, and sometimes fever and upset stomach. When men have symptoms, they may notice signs of watery discharge from the penis, pain during urination, and itching or burning sensations around the penis.
Chlamydia goes away on its own, right?
No, chlamydia does not go away on its own. In women, if chlamydia is left untreated, the infection can spread upward to other reproductive organs, leading to pelvic inflammatory disease, which is an infection of the reproductive organs, including the ovaries, the uterus, and the fallopian tubes. In the most severe cases, chlamydia can lead to infertility in both men and women.
How do I get tested for chlamydia?
You get tested for chlamydia through generally 2 processes, either through a cotton swab of the vagina or through a urine sample. Both are very easy and painless processes.
What happens if I do have chlamydia?
If your test turns up positive for chlamydia, don't worry. The infection is easily treated and cured with antibiotics. However, it's very important that your partners get tested as well.
Is it possible to prevent chlamydia?
The only way to completely prevent chlamydia is by abstaining from all types of sexual intercourse. Using condoms consistently and correctly can greatly reduce your risk of getting or giving chlamydia. That's why it's important to always use condoms when you are sexually active, even if you're on birth control, to protect yourself from chlamydia and other types of sexually transmitted diseases.
So why is it that chlamydia is such a common STD?
The reason chlamydia is so common is because it often goes undetected. The infection rarely shows symptoms. Nearly 75% of women and 50% of men with chlamydia do not develop any signs or symptoms. Infections are common, so people who have had chlamydia and have been treated can get infected again if they have sex with an infected person. That's why it's important to get retested each year for STDs.